Oh,
Good evening, everyone. So today we at Atha, as interns, that is Mandira and myself, Zana, are going to be sharing our views on the topic relationship OCD, signs and ways to cope. So before diving into the topic, let me tell you a little bit about Atha. Atha was established in 2016 in Thane, Mumbai. Atha Psychotherapy is a space to come for psychotherapy, specialized training, workshops for mental well-being, and research-backed content on mental health. Now, about our founder, Asira ma'am, she has done her master's in clinical psychology from SNDT University, Mumbai. She is a certified ACT therapist. She is also an associate fellow and supervisor of REBT Level 2 faculty from Albert Ellis Institute, New York. Ma'am is trained in CBT from Beck Institute for Cognitive Therapy, USA. With all of this, ma'am is also visiting faculty at Swaminarayan Swami Vivekanand College as well as Xavier's College. So let us start with the introduction on what is relationship OCD. Now, relationship OCD, sometimes also called as ROCD, is a form of an obsessive compulsive disorder in which people experience intrusive thoughts and compulsive behaviors related to their relationship with their romantic partner. Now, let's understand this with the help of an example. So, David, a business consultant living with his partner for 3 months, describes his problem as he has been in a relationship for a year, but he can't stop thinking whether this is the right relationship for him or not. He sees other women on street, but he can't stop thinking whether he would be happier with them or with his current partner. He also asks his friends for their opinions on his relationship. He constantly keeps checking and rechecking his feelings, which ultimately leads him to feel depressed. Now, this example depicts a common classic behavior of a person going through ROCD. So, to understand this a bit better, let us dive into the signs and symptoms of ROCD. So, as with all the forms of OCD, the primary symptoms of ROCD include obsessions, that is, unwanted intrusive thoughts, feelings, images, or urges that cause anxiety or distress, and compulsions, which are done in an attempt to elevate anxiety, that is, prove their doubts wrong, or prevent a negative outcome in their relationship. Now, let us look at what obsessions in ROCD sound like. So they can be like, is my partner good enough for me? Or am I good enough for my partner? It can also sound like, what if I'm with the wrong partner? Or is the spark gone? So these were some obsessions in ROCD. Now, compulsions in ROCD are repetitive actions. They can be both thought based as well as behavior based. Now, compulsions are actions or behaviors which are done to lower down the anxiety, and the more you act on these obsessions, the more the anxiety cycle gets maintained from a long term perspective. So, here are some common examples for compulsions. The first very common trait is reassurance seeking. Now, to elevate anxiety, people with ROCD often seek reassurance from others, which can either be from their partner or from their friends. So it can sound like asking their friends, such as, do you think my relationship is working? Or even asking their partner, are you still in love with me? Second, mental review. Another common type of compulsion in ROCD is making lists in one's head to prove or disprove their doubts. For example, someone consumed with the obsession, what if I'm not meant to be with my partner, may come up with a list of reasons that they are meant to be together, repeating it every time they have an intrusive thought to ease their anxiety. They mentally review everything that they've done together, list everything they don't like about their partner, and check for their feelings for signs of affection. Third, social comparisons. This could involve spending hours on social media, examining other people's relationships, and asking oneself, are we happier than they are? So, a most common example of it can be seen on Instagram reels, where influencers and content creators, they make such happy reels depicting such happy couples, and people use them as a standard to judge whether they are happy or not. Fourth, comparing your partner's appearance to others. Fifth, avoidance of things that trigger relationship obsessions, such as intimacy, loving gestures, etc. Sixth, neutralizing. This involves picturing themselves and their partner happy together and trying to recall good experiences with their partner. Seventh, creating rules for their partner and questioning if their partner doesn't uphold with those rules. So these were some common obsessions and compulsions in ROCD. If you have any doubts, then please feel free to let me know in the comments. Okay, now let's look at some triggers of ROCD. Now, relationship OCD uh, symptoms are typically triggered by an event or a situation in a relationship, such as asking a partner to move in together or getting married. It can be triggered by something a partner does or doesn't do. For example, if your partner has been spending more time with friends and family rather than with you, then you might start questioning your place in their life. Or if they don't respond to a text message right away, you might begin to worry whether they still love you or not. Some examples include reading or hearing about other people's relationships, talking with other people about their relationships, finding someone else attractive, attending weddings or other engagements, thinking about previous relationships, as well as forming an emotional connection with someone else. Now, there are two types of relationship OCD. The first one is relationship focused, and the second one is partner focused. Now, relationship focused OCD considers any feelings or symptoms about the relationship. It can cause a person to doubt or worry about the perceived suitability of the relationship. So, relationship OCD symptoms often come in three forms, which can be thoughts, images, and urges. Now, thoughts. This may form a person to question, is the relationship right for me? Or does my partner love me? Second, images. It can be, for example, seeing the other person's face. Urges. A person may feel an urge, such as, should I leave my partner or should I stay with them? The second one is partner focused. Now, this type is more focused on the partner and who they are as a person. Partner focused OCD causes a person to worry about the suitability of the partner in terms of six domains, which are intelligence, appearance, social skills, morals, emotions, and reliability. Now, intelligence, it may sound like my partner is not clever enough for me. Appearance, it can be picking out the partner's respective body parts, such as my partner's nose is too big. Social skills, why is my partner so antisocial? Morals, I cannot believe my partner doesn't care about him. Emotions may sound like my partner is so emotionally unavailable. And reliability, is my partner reliable or trustworthy? So these were a few types, triggers, signs, and symptoms of ROCD. If you have any questions, then feel free to drop them in the comments.
Zena, the point that you mentioned of comparing your relationship to
Yeah,
Instagram, I think that is a really nice point because that happens so much with so much consumption of social media. We intentionally, unintentionally do that a lot.
yeah, I agree. And those influencers and content creators, they try to paint such a lovely picture, like, everything is just fine and nothing is going wrong. And people really do have arguments regarding this, that you could have done this for me. Okay, then now my friend Mandira would go on with her topic. Thank you so much, everyone, for listening patiently.
Thank you, Zina, for introducing us with the topic. So now we'll jump on how to cope with relationship OCD for partners with individuals who have OCD. First is educate yourself. Learn about OCD to gain insight into your partner's condition. Understanding the disorder can reduce frustration and help you provide empathy to them. Second is offer support. Offer emotional support and reassure them when they're struggling with intrusive thoughts or compulsions. Third is communicate effectively. I think this is a very important point. Foster open and non-judgmental communication and allow your partner to express their feelings and concerns without criticism. Next is respecting their boundaries. Respect your partner's boundaries regarding their OCD related behaviors because this avoids enabling compulsion but just helps you understand their challenges in OCD. And the last point is stay informed, stay updated on your partner's progress, on their treatment, and celebrate small wins with them no matter what. Anybody has any doubt in this topic or have any comments, please drop it down in the.
Mandira, regarding the miscommunication point you mentioned, I
Yeah,
think a lot of issues have to do with, not communicating properly with the partner.
definitely. I think in relationships, mostly the other partner wants the other person to guess what they want or to
Yeah,
a lot of guesswork, but that is not how it works. You have to speak out and let the other person know what is really happening so that they can also help you.
exactly. It's like you should be able to read my mind.
Yeah, exactly. So there's a question that says, "What if both have OCD?" So I'm just going to, that is actually the next topic. I'm going to jump on treatment for OCD. So let's cover that. I hope that answers your question. So in treatments of OCD, we have three types of therapies. That is individual, couple, and group therapy. In individual therapy, CBT, that is cognitive behavioral therapy, is considered a gold standard for treating OCD. The person with OCD can work with trained therapists to identify and challenge their obsession and compulsions. Second is medication. In medication, SSRIs, that is selective serotonin reuptake inhibitors, are prescribed, and medication can be beneficial when combined with therapy. Now, the next type of therapy is couples therapy. So, I think this will be helpful if both partners have OCD. Couples therapy, in this also cognitive behavioral couples therapy is used. This helps both partners to learn effective ways to cope with each other and improve their communication. And the last form of treatment is support groups. OCD support groups. By attending these groups, individuals can have feel a sense of community and share their experiences. It can be really comforting knowing that others are going through similar challenges. Okay, so what do you think of this, Zena?
I think couples therapy would really help if both
Yeah,
the partners are going through ROCD, because it gets difficult to, you know, be okay, because like if one partner needs reassurance seeking, then the other would constantly, indulge in mental review, that is constantly looking for, doubts. They would be constantly thinking, what if my partner loves me or not, and the other person is constantly seeking reassurance. So I think it gets hard. So couples therapy is
yeah.
would really be helpful.
Okay, so uh, going to our next topic, that is self care for partners with OCD. What do you guys think? What are some self care tips for partners with OCD? You can write your answers in the comments below. Okay, so I'll go on with the points and maybe you all can add anything later. So, my first point remains the same that I mentioned previously, that is communication. Communicating openly is very important. Encourage your partner to talk about their feelings and experiences with OCD. Be a good listener and validate their emotions without judgment. Second is being patient and compassionate. OCD can be frustrating for both you and your partner. It's important to be patient and show empathy. Avoid criticism or making your partner feel guilty about their symptoms. Next is set boundaries. While being supportive, it is crucial to set healthy boundaries. Understand when to provide space and when to offer help, but respect your partner equally. Next is avoid enabling. It can be really tempting to participate in your partner's ritual or provide them reassurance, but this can reinforce OCD behaviors. Encourage them to work on them with a therapist so they get professional help also. And the next form is self-care. Caring for yourself is also equally important. Remember that you can't pour from an empty cup, so maintain your hobbies, interests, and friendship outside this relationship too. So, yeah, we have some comments saying avoid comparison. Definitely, I think that can be a really big trigger point, right, Sana? I'm sorry, you're on mute.
Sorry. I was saying, yeah, I agree with you.
And also having couple goals in healthy way. Yeah, I think, yeah, in couples therapy, you all can build up some goals to achieve together.
I think it also has to do a lot with being patient with the other person.
Definitely. Okay, moving on to the next topic. This is tips for those who are going through relationship OCD. Now, in this, it's important to channel your irrational thoughts, work on identifying irrational thoughts, and challenge them with evidence. The next is accept uncertainty. ROCD, that is relationship OCD, often involves a need for uncertainty in relationships. Learn to accept the uncertainty and before having any significant step in managing the condition. Okay. Do you guys have any other point that you would like to add in this? Okay, all right. So, Zena, do you have anything else to add?
I think that relationship OCD is also, you can understand it with the help of like a flower, like, taking out its petals, like he loves me not.
Oh,
So
yeah.
it can be um, done as if like, okay, one petal stands for
Mhm.
are they the one, the second
Yeah,
one can be have I been cheating on them, the
yeah,
third one maybe they are not good enough for me anymore,
yeah.
the fourth, do I even love them enough? So I
Mm.
think it's an easy way to understand what exactly is relationship OCD,
Mhm.
like, the thoughts that go into it, intrusive thoughts, unwanted feelings.
I think this is a classic example that's shown a lot in movies. And
Yeah,
yeah.
it's like every movie just like shows this scene. And
Mhm. Do you also think Joe from the Netflix series You is an example of this?
yeah, we can say that to a certain extent
Mm.
he is.
Yeah.
So these characters from on TV series and movies, people better get to understand them.
Yeah. If you guys have any characters in any series or movies that you can relate to this topic, please write them in the comments below. We'd love to like discuss about them. I think self care for the other person is also very important. Like the person in a who's not diagnosed with OCD in the relationship.
Yeah,
Okay, so thank you so much, everybody, for giving us your time and attending this session. It means a lot to us. If you have any questions, we will link down our social media handles down below in the comments. So you can write us there. Okay, there's a comment saying at times we have characters which will include such thoughts in someone, and so they develop such a pattern. Mhm. Yeah, I think what we, what we consume is also a really important part.
exactly. Like the social media these days and also the TV series, we derive a lot from it and try to relate it with our life. So it also plays a major part in how we think, how we make decisions regarding things.
Mhm. True, true. Okay, everyone. So thank you so much for being here. If you have any questions, we'll link all our social media handles down below. Please go check it out and write us there. If you have there are a lot of events happening at Athar, so please participate in them and follow us there.
Yeah, we have orientation to Indian psychology coming up. We have study circles for mental health professionals. So we also have a trauma therapy workshop coming up. So you can join in on those sessions. If you want to know more details about it, then click the link in the chat. It'll guide you to all of the details. Okay, then thank you everyone for
Thank
joining.